I think the biggest lessons to share aren't so much about PPE and ventilators anymore, but what I think the main lessons have to do with understanding when patients come into the hospital in an epidemic, when you can't have family, friends, and other people involved in their care the way that we do normally. One of the great ironies of the height of the pandemic was that the hospital was as quiet as I have ever seen it, because there were no visitors. There was no one coming in or out. The patients came in through the emergency room. No one was coming in the front door except at the change of shifts, the staff. The lobby was empty, and really being sure that you have ways to communicate with patients' loved ones to update them, particularly since so many of the patients were intubated early on, having a system to update the families on what the progress was and what the situation was, as well as to be able to brief the administrators on what the course was, is really an exercise that should be modeled by anyone who's looking at this particular problem as it begins to come a little bit closer to home.